Hey again, this is Tammy Lynn Hancock, and my job here on YouTube is to help you understand the benefits and get the information and be an informed consumer and user of CBD hemp plant extract oil. Today's topic is I want to talk to you about some of the proven benefits of CBD or hemp plant extract oil so that you know what is it used for, because a lot of us are out there, we've been hearing about it's called the green rush that's on right now, and since President Trump signed the hemp bill back in December 2018, now hemp has been separated totally and forever from its cousin marijuana. It's got a multitude of industrial, agricultural, and medicinal uses. And so the purpose of this YouTube video is to help you guys understand how it can be used for medicinal purposes. A little bit about my story. I'm an RN of 35 years. I've been a hospice nurse for a majority of that time. But in my lifetime, in 2009, my son Aaron died of an accidental overdose of oxycodone and Xanax. Since that time, I've been professionally speaking and out against accidental drug overdoses, looking for natural, healthy alternatives to people who have real issues with depression, pain, anxiety, insomnia, sleeplessness. These are chronic issues people have: Alzheimer's, dementia, arthritis, those kind of things. And right now in our society, we only have medications that are often addicting, and many people don't know how to use these medications. They combine them and they have accidental overdoses. So one of my passions is to educate and to help people learn how that they can find natural, healthy alternatives. Hence, when CBD oil became more and more prominent, when there have been some quality companies out there really educating, using it, manufacturing it, I decided that was something I needed to look into more, and that's what I want to share with you today. What are some of the benefits? What is CBD oil used for? There are lots of studies out there on CBD oil, so you just don't have to trust me when it comes to talking about CBD oil. Go on your computer, be an informed consumer, look up for yourself CBD oil, look at some of the government studies that are out there. One of the things I want to talk about first is, number one, is that CBD oil is known to reduce pain and inflammation. And this is really one of the top things that it is used for. In the Journal of Experimental Medication, in a study in 2012, it found that, and I'm going to read this, that CBD significantly suppresses chronic inflammatory and neuropathic pain. Okay, neuropathic is that nerve pain, that's sharp stabbing pain. So in this study, they found that CBD just suppresses that inflammation. What does that mean for arthritis? What does that mean for people who have back problems, who constantly have that inflammation and pain that's constantly aching? What about those people, those diabetic neuropathies who have those shooting nerve pain? Can you see how this is exciting? So, they show this, and the study goes on to suggest that CBD oil is a good agent for treating chronic pain. There was another study in 2007 conducted in Canada, and they were showing how they use CBD oil and another spray, THC, which is part of the marijuana plant. It was a spray they put in the mouth. And these people had significant studies that results in neuropathic pain, that electrical shock pain, and multiple sclerosis. This is like super excited. So one of the other things I want to talk to you about is that how does CBD oil have against psychoses? It has been shown to be, clinical trials have shown people with schizophrenia helped prevent the experimental psychosis that comes from schizophrenia. So there's some antipsychotic effects that have it. Remember that CBD oil does not get you high. CBD oil does reduce anxiety. And remember, CBD oil is safe because it works in our endocannabinoid system that you and I have. All mammals have it. Look it up. Endocannabinoid system. And interesting, what is the main ingredient in CBD oil? Cannabinoid oil, okay? You don't have an Xanax system. You don't have an endo-oxycodone system. You don't have an endoaspirin system. You have an endocannabinoid system. Very interesting. So anyway, there are studies out there that shows on both animals and healthy volunteers that CBD does reduce anxiety in patients. Look at this, how exciting this could be for people with panic attacks, anxiety, getting off the Ativan, and helping people with those panic attacks that they get where they get these sweats where they can't even leave their house. How about obsessive compulsive disorders or post-traumatic stress disorders? How about a lot of our vets and victims of criminal offenses and crimes? There's studies out there from 2011 where they've done some studies with CBD and a placebo, and they found that people had significant effects and reduction in their PTSD and their anxiety. These are some great studies that are out there. CBD also helps to fight cancers. I saw a government study done in 2015, and I just Googled it. And it showed that it inhibits cancer cell migration, adhesion, sticking to it, and invasion. And there was a study in the 2006 Journal of Pharmacy and Experimental Therapeutics that, I'm going to read that, for the first time that CBD potentially inhibited the different breast tumor cell lines and exhibited significantly less potency in non-cancer cells. So it was able to, go into that tumor line and work against that. This is like 2011. There's studies on it that shows CBD with a cellular mechanism that it has effects on tumor cells, and that that there's no toxicity effects. That you can take that. So it's been working very well. There are data and suggests that it can be used to inhibit the invasion of lung, colon cancer, and then it has anti-tumor properties and gliomas. Those are brain cancers and things like that. It has been used to treat leukemia. Now again, I'm not putting medical claims out there. I'm not a research. I'm just sharing with you some things that I found on the internet. I'm sharing my own personal studies that I've had here. So what I want to explain to you is that there are great benefits to using CBD oil. Relieves pain and inflammation. It has antipsychotic effects. It reduces anxiety. It helps fight cancer. It helps relieve nausea. It works in the endocannabinoid system and helps get rid of that nausea. Nausea often comes from pain. And remember, we talked about CBD oil being very effective in pain. Nausea and pain are bed partners. Think about when you sprained your ankle. The first thing you got was searing pain. The next thing, wave of nausea. So nausea and pain are often bed partners, and CBD helps with that. CBD is also known to treat seizures and other neurological disorders. But let's talk about the nausea. It's been used for centuries. Just do a Google search on how long ago they've been using cannabis. Long time. The Declaration of Independence was written on hemp paper. So what they found in the British Journal of Pharmacology in 2012 that CBD oil has anti-nausea effects, keeps you from chucking your cookies. It also is known to, in a study in 2014, it's a study that was conducted by some researchers at Stanford University, and you can find these online yourself, that CBD oil may treat seizures and other neurological disorders. Super, super important. A 2006 study shows that CBD, and I'm going to read this, significantly reduced the incidence of diabetes. And in 2013, the American Journal of Medicine published a study that showed the impact on CBD and glucose, insulin resistance. This is super important. Can you imagine what this is going to do to open up the world for diabetics, to help get rid of their neuropathy, that common thing that happens with them? CBD also promotes cardiovascular health. In a study done in 2013, published by the British Journal of Clinical Pharmacology, it said that CBD protects, and I'm going to read this, against the vascular damage caused by high glucose environment, inflammation, type 2 diabetes, and leaky gut syndrome and all those kind of things. So while I'm not making medical claims, I am quoting some things from studies that you can go online and research yourself. Go look for yourself. CBD and cardiovascular health, CBD and seizures. So I hope that you're seeing a really cool thread of information here. That's the medical community now is starting to pay more and more attention to the effects of CBD. It is a wonderful property, anti-emetic, anti-tumor, anti-inflammatory, appetite stimulating. It helps people with restless legs. People have reported to stop their insomnia. It has anti-convulsant, anti-seizure, antipsychotic, antioxidant, neuroprotective. And again, when you combine this with the endocannabinoid system that you and I have, and you see how if you are deficient in these areas, that's the cannabinoid within CBD hemp plant extract oil actually replaces what your own body is deficient in, so it can help restore and heal naturally. Now, isn't this like super exciting? So I hope that this opens the door to you to really understand more about CBD oil. What is it used for? And again, I'm not making medical claims. I'm encouraging you to go out and research yourself. Many of you are going to have questions. Tammy Lynn, thanks so much for this, and I appreciate it. I love your comments. Please share. Let people know. Let's get this information out there. I will drop below in the comments where you can purchase legally in all 50 states in the US of A, a pure quality, third-party tested CBD oil you can have delivered to your door. You can have a product that's delivered to your door that is safe for your pets. It comes in an ointment. There's some different forms of the oil that comes. What's really important is that you buy from a quality company, one that follows the regulations, one that is third-party tested. That means every batch is tested so that you know exactly how much CBD oil is being put in each bottle, how much you are ingesting. That makes the whole difference in you being able to have a good experience with CBD oil or a bad one. The other day, I opened a bottle of CBD oil from another company than the one that I love and use. And theirs was thick and yellow, and I was grossed out. It was not third-party tested. The other day I was speaking to my friend, and she'd been taking something that she bought in a grocery store. She says, Tammy Lynn, I can't stand it. It tastes like wood. And I tasted it, and she was right. It tasted like wood. When you're buying from a pure company, you can get get the great benefits in knowing you're getting pure CBD oil. You see, the cannabinoid is a non-water soluble oil that must be mixed with a carrier oil, and it is used sublingually. That means right there under your tongue. It absorbs right there in the mucous membranes in your mouth and goes directly into your bloodstream. How cool is that? My own experience, having severe abdominal pain, I am not using narcotics. When my husband 3 weeks ago had spinal fusion surgery, he was home 3 days from the hospital, started using his CBD oil, and has been totally off narcotics from that day on. If you've ever had spinal fusion surgery, you know how painful that is, the nerves, the spasms. He was in so much pain in the hospital, they couldn't get his pain under control. So I hope you found this helpful. Please feel free to watch some of my other videos. I'm going to be doing some on teaching you about the endocannabinoid system, going into a little bit more detail about the properties that CBD oil has, to answer your questions, to help dispel the myths, to help you find the places where to get quality CBD oil. Yes, the CBD and what they call the green rush is on. Get it for yourself. Get out there and at least get it at the best price for yourself. And if you share it with other people, okay, make some money off it, great. But you can get it delivered to your house at a super reasonable price at a super quality company. And I will share that information for you in my notes below, and feel free to message me. Thank you so much for watching today. I hope this helped give you more ideas of what CBD oil is about. If you've got some questions, feel free to ask me. I'm here to help you, to help educate, and most important, to give you some tools to find some natural, healthy alternatives to addicting drugs. I'm Tammy Lynn Hancock. I'm the little engine that could. I also do teaching and training on attraction marketing, and my passion here is to teach and train on CBD hemp plant extract oil. You see, I'm the little engine that could, and I can overcome the impossible because I just don't give up. And don't you give up trying to overcome your chronic pain, your MS, your anxiety, your seizures. Don't give up to try to find natural alternatives so that you can get the best quality of life. God bless you. Have a good day. Bye.